under the European Public Health Week. And today we will start the discussion of health is a political decision. Unfortunately, today's main speaker, Mr. Mehmet Güloğlu, won't be able to attend us due to internet network problems affecting East Africa because he's working in Tanzania right now. I want to inform you about it at the beginning. We are very sorry about this and related inconveniences, but we will start the discussion with Professor Mustafa Taşdemir today, and then we will reschedule other webinar and we will inform all the registered participants. I am Sabanur Çavdar. I'm a medical doctor, a public health specialist. Greetings from Istanbul. Currently, I'm working at Eyüp Sultan District Health Directorate in Istanbul under Ministry of Health of Turkey. And to start today's discussion, I want to introduce you Professor Taşdemir briefly, and I will let him to talk about health and this political decision. Professor Mustafa Taşdemir is a professor of public health, and he has a distinguished career in both private sector, public sector, and public sector in Ministry of Health, different health directorates, and especially in academia. He earned his medical degree from Marmara University School of Medicine in 1919. And then he worked at the same university at different levels. He has a distinguished career in public health and healthcare management, and he's a great mentor to us, to young public health professionals. So thank you for your time, Professor. And briefly, I want to give you the talk, and we can continue our the opening of this webinar. Thank you.
Okay, thank you, Sabanur. Hello, everybody. Now, this is just an opening session, and I will talk briefly about the topic and make an introduction to the topic. And I have a PowerPoint presentation composed of 10 slides. So let's start. Now, since I'm a professor, I ask a question first. This is like an exam, which is not related to health. Which of the following is not related to health? Tobacco taxes, divided highways, common girls go to school campaign, a campaign in Turkey, watching TV, drinking coffee, working hard, wearing seatbelt, and hobbies. We can add other items to this list, and they are all familiar things and activities. Some are our daily habits. So we can have an idea. We can give the right answer to this question. I think all of you would say that all are related to health to some extent. Now let's go a step further. There is a list of ministries common in the world, beginning from agriculture, ending at youth. This is an alphabetical order. Which ministry is not related to health? I think again, you will say that all are related to health to varying extents. Yeah, everything affects health, as you know, but not everybody thinks health is their problem. As health professionals, we do not expect other people to solve health problems, actually, but it's a must for other people and other sectors to take part in health-related issues. COVID on the COVID-19 pandemic already has shown this fact to us. Just a couple of years ago, we experienced an unprecedented public health crisis. This pandemic has shown how a health threat can cause massive disruption and affect most. We have also seen how countries can step up to the challenge with different branches of government working together to create large-scale intersectoral responses to protect health. And most countries have implemented measures to prevent disease transmission that were previously almost unimaginable, including reorienting health systems, controlling borders and internal mobility, redirecting the economy, and taking sometimes severe civil protection measures. Heads of government in the world have had no alternative but to work with their health ministers and other ministries and sectors, including social affairs, internal affairs, foreign affairs, economic affairs, tourism affairs, etc. There are some positive and negative effects or consequences of the pandemic, as you know. The pandemic has affected our lifestyles deeply and permanently. It would be very nice to continue intersectoral collaboration for health realized at the pandemic, at that period. But we see that this aspect has totally been forgotten, unfortunately. As you know, peace is a determinant of health. However, the world is talking every day about the Third World War. There is an ongoing war in Ukraine. There is an ongoing genocide in Palestine. What a pity. Now, I think every one of you have heard of these slogans. There are various slogans in the last maybe 2 decades. Health for all for health, health in all. Health is a political choice. The last one is the title of this week, you know. All of these slogans or mottos imply that politicians and decision makers should give priority to health in policies. This sounds good and nobody is against this actually, but what about the reality? There is no objection to this, but achievement is very limited. Now, let's go into detail. Health in all policies. The first slogan, health in all policies, can be schematized like this. There is health sector and other sectors, and there is a unidirectional relation between the sectors. Other sectors produce some health benefits for the advantage of health sector. But this sounds somewhat antipathetic. It's not lovely for the whole community, whole sectors. If we talk about health for all policies, there is bidirectional relation between the sectors, as you see in the scheme, in the figure. There are co-benefits both to health sector and other sectors. Health for all. All means everybody in the community and also all other sectors. This is more sympathetic, and other sectors may adopt this more easily, I believe. So with this understanding, health status and health policy generates core benefits to other SDGs. SDGs means, as you know, Sustainable Development Goals. They cover every sector, every aspect of human life. What about the SDGs? Let's remember them. There are 7 goals declared by the United Nations, beginning from no poverty to quality education, from healthy cities to climate change. It covers everything. You see the figures about the targets, the numbers of targets, publications, and about 8,000 activities. It's a comprehensive set of activities. It's a comprehensive program, as you know. So health provides benefits to all community, all sectors, all aspects of life in the world. Now, let's briefly present the conclusions. Health in all policies was a starting point that's now ready to develop into health for all policies. After the pandemic, we have learned that investing in the resilience of health systems is a key for a country's economy and security. A more practical and constructive approach is to focus on the core benefits of policy and investment to reach our main goals. Of course, these are not easy to realize in the short term. We have already forgotten the importance of this fact. Maybe we should wait for some time and it will be realized slowly. But now we can do something immediately. We can get localized, globalized. Globalized means globalization plus localization to implement the principles and methods described at the global level to implement them at the local level. We can do this immediately, no need to wait. So I believe a district health manager, a junior health professional can do many things, can produce many benefits to the community, to the local community, than general director at the ministry or a senior professor at a university. This is good news, actually. And also, youth leadership is crucial and indispensable. Our future is entrusted to youth, so youth leadership is important. These are not the sayings by me. Globalization is the main topic of Wednesday agenda of UFA, and youth leadership is in Friday agenda. I recommend you to follow, to participate in those presentations also. Now, this is a youth activity, actually. Members of the HADI organized this program throughout the week. These friends and others have contributed a lot to this program. I thank a lot to each of them. Thanks to Istanbul Medipol University, thanks to UFA, and thanks to audience. This is the references, and that's the end. Thank you all.
Thank you, Professor. It was
You're welcome.
a great start, and it was eye-opening, wide-opening for us. And you remind us the key terms about health in all, health for all policies, and sustainable development goals. And as young professionals, you gave us great insights. Thank you for the presentation.
Always.
And thank you for opening these week's webinars. And I also wanted to underline the term of globalization or global politics or global actions, both global and local actions. And in this global world, we are thinking about almost everything globally, but also it's, as public health professionals, it's really important to define and address the local problems and local solutions. And as you have mentioned, it's a new term, but it's an important term, localization. Thank you for this.
You are welcome.
Great presentation. And I want to ask the participants, thank you for joining us today. And do you have any questions or comments? If you can just type them in the chat, and I can ask these questions to Professor. At this point, I want to, when we are waiting for the questions or comments, I want to remind you that Mr. Mehmet Güllüoğlu won't be able to attend us today due to internet network problems affecting East Africa. So we will reschedule this webinar, and we will inform you via your emails. Till this time, we were hoping him to join us and overcome this network issue, but he sent us that he's very sorry and he couldn't attend. He tried so much, but it's it's over than one country problem, so he won't be able to join us for today. I'll check the questions to see if there's any question or comments. Okay, not yet. So to be respectful to your time, I want to remind you this week's upcoming webinars of Society of Public Health Thinking and Innovation. Can you skip the slide, Ayşenur? Yeah, tomorrow we will be listening Yasemin and Yusuf with the topic of mental health for all, immigrant access to mental health care. They are both working on public health, public mental health, and they are doing their PhDs in public health. And on Wednesday, we will be listening dear Seval. She's also a public health professional and faculty from Istanbul Medipol University, and she will present us building livable communities, insights into age-friendly cities. And the other day, we will be together on Thursday. We will be talking about universal health coverage in an aging world. And on Friday, we will be listening Synergy for Health, bridging the public-private sector from Professor Ömer Ataç. Like I mentioned, we will reschedule today's webinar, and we will be sharing the updates soon with you. And we hopefully we will make the webinar possible this week. It's based on the internet network problem, as you can understand. Okay.